Hi, my name is Miranda. I'm going to be your student nurse for today. I closed the door behind me to ensure patient privacy. Here I am washing my hands now for 20 seconds and then putting on my PPE and my mask. Can you tell me what brought you in today? Just a checkup. Just a checkup. Okay, I'm just going to ask you a few questions. Just answer them to the best of your ability. Could you tell me your name, Patty, your age, and your date of birth? April 18th, 2000. Okay. And then this is a really weird question, but can you tell me what year it is? 2021. 2021, yep. And then can you tell me what state you're currently in right now? Perfect. And then can you tell me how tall you are? Awesome. And how much do you weigh? 180. 180, okay. So doing a calculation, your BMI is a 27.4. I'm going to ask some questions that are a little more towards your targeted organs of your muscles, your nerves, and also your abdomen. Is that okay? Yeah. Okay, awesome. Have you recently noticed any pain or joint pain or stiffness? No. Any redness around your body? No. Any swelling in your lower upper extremities, like your arms or legs? No. Okay. Difficulties with moving your arms and legs? No. Do you have any muscle pain or weakness? No. Any recent or past any past bone traumas? No. And do you just have any general pain right now? Okay. And then I'm just going to ask some questions, like, are you able to do some activities of daily living, such as brushing your teeth or using the restroom? Yeah. Perfect. So moving on. Have you recently had any headaches or noticed dizziness? No. Okay. Have you had any recent head injuries, seizures, or tremors? No. Have you felt weak recently? No. Or felt off balance? No. No. Any difficulty in speaking or swallowing? Do you have any stairs, or are you able to go up the stairs without any problems? No stairs. Okay. And then is your house like clutter free? Do you have any like hazards that could be in there? Yeah, it's perfect. And then do you have a family history of stroke by any chance? No. Okay. Well, I'll just give you a little bit of like some signs of a stroke. We call it fast here. So you would ask the person that you think may be having a stroke. If their face is drooping, you'd ask them to smile. If you see the face drooping, that's obviously a sign. If you ask them to raise their arms, if one of their arms is not equal to the other, that's not good. And then if their speech is slurred, that's not good as well. So what you would want to do is call 911 at that point if you notice any abnormalities. Perfect. And then how's your appetite been? Good. Any difficulties swallowing? No. Do you have any intolerances of food? Do you have any pain in your abdomen area? Do you have any nausea or vomiting? No nausea? Okay. How are your bowel movement habits? They're good? Okay. Do you have a history of IBS or celiac disease, whether that's you or your family? Okay. And then are you taking any medications for your stomach? No. And then how's your diet been? You good? Awesome. So the next thing I'm going to do is I'm going to do a more thorough assessment. So I'm going to start with your muscle and your skeletal range of motion, and then I'm going to move on to your nervous system and check out some of your cranial nerves, and then I'm going to follow it with the abdomen. Is that okay? Yeah. Perfect. So the first thing we're going to do, I'm going to set this right here. Don't mind sticking your arms out and back. Do you mind lifting your arms up to the side? You want to flex your, yep, just like that. And then you want to do circles with your shoulders. Perfect. And then you want to point your toes up and then down. You want to bend your leg out and bend your knee. Perfect. And then if you want to stand up for me, you want to touch your toes, move your body side to side like a penguin. Perfect. And then do you want to rotate side to side like this? Perfect. Perfect. So go ahead and sit down. I'm gonna next test your muscle strength. So you want to put your forearms out for me. I want you to push against. Perfect. Now pull against. Awesome. Now we're gonna stick our arms out. When you push and then push again. Awesome. Then we'll do that with your legs. If you want to lay down for a second, just lift your leg up for me. Go ahead and push against. Perfect. Go ahead and push. Awesome. We'll do the other leg. Push, push, push. Great. And then, last thing, if you want to sit up for me, is you mind doing your jaw. We're going to open your mouth a little bit. I'm going to shake it back and forward, up and down. Perfect. So the next thing that we're going to do is the cranial nervous evaluation. So the first thing I'm going to do is I'm going to have you close your eyes and I want you to smell this for me. You smell? Perfect. And then the next thing I'm going to do is I want you to focus on a point ahead of me. And I'm going to move my hands. Tell me if you still see my fingers. Perfect. Perfect. And then we're going to check your pupils. I'm going to use my pen light. So go ahead and just look at me. And one more time. Awesome. The next one that I'm going to do is I'm going to have you punch your teeth. I'm going to palpate. I'm going to touch. Make sure that's good. Awesome. And then I'm going to take this object and I'm going to close your eyes. Just let me know if you can feel this or not. Yeah. You feel that? Yes. Perfect. So then the next thing I'm going to do is just have you smile, frown. I like your frown. It's cute. And then just puff your cheeks. Perfect. And then the next thing I'm going to do is I'm going to whisper something so let me know if you can hear it out. Yeah, perfect. And then in this situation, we would be using a tongue depressor. I would ask her to open her mouth and I would put the tongue depressor and have her say ah, and I'd be checking the interior of her mouth, make sure everything is working. And then the next thing I'm going to do is I'm going to put my hand under your chin. You just want to go and resist against it like we did earlier. So go ahead. Perfect. Go ahead. We'll also do that with your shoulders. So go ahead and push. Perfect. And then I'm just going to inspect your tongue real quick. You want to stick it out. Perfect. And then I just want you to say these few words. Can you say night, tight, light, and dynamite? Perfect. Thank you so much. Oh. Oops. Okay. So the next thing we're going to do is a finger nose test. So I'm going to stand with you when we do this. Go ahead and stand. So you're going to take your finger, look at it, and just bring it close to your face. Do that about one more time. Perfect. And then the next thing I'm going to do is I'm going to have you walk foot in front of foot, put your feet together. Go ahead and just walk one foot in front of the other, testing your balance. Perfect. Go ahead and walk back. No, you're okay. And then the next thing we're going to do is have your feet together, stand up straight, close your eyes, and we'll do that for about 5 seconds. Okay. Grab the forward. So the next thing I'm going to do is I'm just going to touch your forearm and the interior form. So everything feel good. You just feel that on both sides. Yeah, perfect. And then I'm going to give you an object. So go ahead and close your eyes. I just want you to tell me what this object is. If you don't mind moving your hand. Perfect. Can you tell me what that is? It's a coin. It's a coin. Good job. And then while your eyes are still closed, I'm going to draw a number, and I want you just to tell me what that number is. 3. Perfect. Good job. And then the next thing I'll just do is I'm just going to like put your elbows and stuff so you want to sit down. Just gonna. This is my thingy I'm going to hit with. Okay. Okay. Perfect. And perfect. All right. Good job. So the last thing I'm going to do is I'm just going to check your abdomen, make sure everything is okay. So if you want to just lie down for me. Awesome. In this situation, I would ask the patient to lift their shirt up, and I would be inspecting for symmetry, making sure that there's no issues with their skin, making sure that there's no, or if there's any hair distribution, and just making sure everything's okay. So the next thing I'm going to do is I'm just going to listen to your bowel sounds, and what you're going to want to do is you're going to want to rub the diaphragm, and you're just going to listen. Okay. And then following that, I'm just going to be percussing the abdomen now. And you're going to want to do this in a circular motion. So. All right, everything hears and feels pretty good. And then I'm just going to push down on your stomach a little bit, just so you don't feel any pain, okay? Anything? No? Okay. Okay. Awesome. And then the last thing I'm going to do, if you just want to sit up for me, is I'm just going to check your back. The other side. Sorry. Okay. Your doctor will be in. Okay. And that's the end of assessment 3.